It's not enough just to treat cancer, and it's not enough just to beat cancer. This is Paul's Heart. I'm Paul, author of the book Paul's Heart: Life as a Dad and a 35-Year Cancer Survivor, available on Amazon. Medicine needs to do more to help and prepare cancer patients manage their life once their cancer journey has come to a conclusion. Treatments are done, you're told you're in remission, and just show you to the door. That's not good enough. Cancer patients and survivors soon enough find out almost right away. There are things that they're not told about to prepare for once they finally get turned out on their own. Simple things such as dealing with lingering fatigue. Okay, we think that we're done with it once the treatments are over, but the fact of the matter is your body has been through so much to get to that remission. It still has a long way to recover, and fatigue can take a long time to resolve. You still need to follow your body, listen to it. Okay, when you have good days, do what you can. Don't push yourself because your body will fight you on that. Now, this fatigue can last anywhere from weeks to months and, yes, even years. But it all depends on how you manage that fatigue. But that's very real. Also, you got to understand your body is going to react differently now. Once you're done with your treatments, everything that you've been through, how you heal, how you react with infections, everything is different. And that means that you have to respond differently when you call the doctor, especially for infections, fevers, things like that. The biggest one that they don't prepare you for is dealing with scanxiety. And yes, that is an actual word, at least in the cancer community. That's where one of the biggest things that weigh on a cancer survivor's mind is when they have to go for that follow-up scan. Not just the blood work, not just the office appointment, but the actual scan, because the scan is what will pick up any possible return of the cancer, if any. And until we hear the words, your scan is clean, it produces an amount of anxiety you can't even describe. Doctors need to do a better job of preparing people for that. Of course, just as when you're going through your treatments and going through the cancer journey, the financial issues don't stop. The only difference is not having to spend your time feeling like crap going through treatments. You now have a clearer head and can see all the bills that piled up and everybody wanting to make arrangements with you. You know, if you have to, find a financial counselor to help you work these things out. There are ways to manage debts from the treatments without letting that get overwhelming. And of course, if you followed my page, my websites, late side effects. Okay, at some point, probably around the 5-year mark, your oncologist is going to say, okay, the chances are pretty good your cancer's not going to come back. We don't need to see you anymore. But that's not true. And oncologists need to start telling their patients when they dismiss them like that, they still need to be followed up by their primary care doctor forever. Why? Because all of these drugs, all of the radiation, or whatever treatments they've received have the potential for late developing side effects. And the only one who's going to be able to determine that is a doctor. And that's a doctor looking or being aware of the potential side effects. For instance, back in 1988, when I was diagnosed and treated for Hodgkin's lymphoma, I was told there was a chance of pericarditis and also a secondary cancer. That's simple. That's all they told me. Okay? I now have a list of over 24 different diagnoses. To keep it simple, cardiac, pulmonary, endocrine, gastroenterology, muscular, and a whole bunch of others. There's issues with each one. My heart right now is the primary one. But you have to be followed up. And it doesn't mean that they're going to find anything. It's to stay on top of if something were to develop. And this late side effect surveillance is important to catch the stuff before it becomes too late. And then finally, when you're done with your treatments, who's still hanging by you? Chances are pretty good as you're going through your treatments, people start disappearing. And even in the end, who's still there? And then you've got to deal with the emotions of that. When you find out your supposed worth. Now, granted, it's not necessarily their fault. Some people aren't meant to or trained to handle the bad news of cancer. Yeah, I know. Neither are we. We're not trained to prepare for cancer. We get thrown into it. We have to deal with it. And we expect those closest to us, friends or family, to be there for us. And the reality is, not everybody is in the end. You need to prepare for that. Definitely find those that are definitely going to stick by you. You'll know soon enough who they are. I talk a lot about survivorship issues. I talk about my experiences as a cancer patient in 1988, even though my treatments are no longer used. They were horrible, they were barbaric, they were toxic, and we weren't expected to survive them. But here I am, and I get to see the progress that's been made in cancer research, from diagnostics to treatments. So I want to use my TikTok page, Paul's Heart, to inspire people to be proactive, to advocate for their care. Get help when you need it. Don't underestimate mental health during and after your treatment ends. That's huge. There's no stigma to it. If you need to talk to a counselor, and by that I mean a social worker, a psychologist, a psychiatrist, a therapist, whatever, a peer-to-peer support group. But don't underestimate the power of speaking to somebody, whether it be a doctor, counselor, or a fellow survivor who does understand emotionally what you've been through. Please take care of yourself in your survivorship. I can tell you, in my 37 years of survivorship, I've had my bad days, but I've had so many good days. And it's when I have my bad days, those that I've been sharing my good days with understand my bad days and help pull me out of those bad days. Cancer survivorship is a good thing, and it's happening more and more. More cancers are being treated, more people are ending up in remission, but we still need to prepare everybody for that life after cancer, dealing with fatigue, your body, anxiety, financial, late side effects, and who's still there with you in the end. Until next time, this is Paul's Heart.